So everyone says that, Tal, you're amazing. We want to challenge each other. We want to sort of actually, for you to leave this session and actually learn something that you can take away with you. Right, so to the stage, guys, and I'll give you a little round of introductions. We've got enough mics. We can share them, can't we? Yeah, we just have to share those three. Yeah. So, Austin.
Where would you like to sit? Thanks.
Right, we'll do a quick round of introductions and then get started. So please think of questions that you've got. So those words are fairly ubiquitous: productivity, innovation, and culture. What does it mean? If you start off with introductions first, Austin.
Hi, good morning, everyone. My name is Austin. I'm Director of the Self-Care Academic Research Unit at Imperial College London. I have a role in the NHS. I was an innovator in the past, working with lasers in the eye, and now I do public health research. Really pleased to be here. Thank you.
Thank you. Chris.
Hi everybody, I'm Chris. I'm the Chief Exec of CW+. That is the charity arm of the Chelsea and Westminster Hospital NHS Foundation Trust. I also confusingly sit on the board of that trust, and I'm co-lead for innovation in a joint venture called CW Innovation, which straddles the two organisations.
And another Chris.
Another Chris. So my name is Chris Bound. I'm a children and young persons diabetes nurse working across West London Children's Healthcare. Everything I do is innovation, making the lives better of children and people, I think.
I'm Charlotte Wickens. I'm a policy advisor at the King's Fund, and we're looking quite a lot at productivity at the moment, and I sit within a team that looks at the external environment, so looking at what the government's plans mean. Right,
so let's start with you, Charlotte. Productivity. So the idea is that technology, innovation, it's basically, it means that you end up becoming more productive, right? And the government has just given, is it 25 billion-ish pounds?
Yep.
There or thereabouts. And that money is linked to a 2% increase in productivity. I have no idea what that means. Where does that, what does that mean? And where does the 2% come from?
So I think the 2% comes from the fact that the NHS has been there's been a big dip in productivity. I think that's not going to be a surprise to anyone after the pandemic, but also it kind of been slowing down even pre-pandemic. And that was because productivity is a measure of how many outputs you get from the inputs you put into a health system. So after having a kind of squeezed budget for the kind of most of the 2010s, productivity actually looked pretty good because some of those things were being held down in terms of like capital spending. And then it started to kind of fall a bit off a cliff just before the pandemic. And so now what we're trying to see is the NHS returning to the kind of productivity growth it had pre-pandemic, and the 2% is a kind of realistic, slightly challenging target. But NHS England's board meeting last week, they reported that they'd in kind of their Q1, they'd achieved 1.8% productivity growth. But actually that only counts the acute sector. So that's one of the big challenges that we have with productivity measures as they currently stand, is that they don't really capture anything outside of where we already measure lots of activity, which is mainly within the hospital and acute sector. And so looking at kind of the productivity that we might have gained by using things like virtual wards, so using some of that technology, are not quite being captured yet by the measures that we currently have.
So that's a problem, isn't it? Because I've spent the last couple of weeks trying to work out what NHS productivity means, and I really struggled. And newsflash, not many other people. I had to go to the King's Fund.
We had to have a conversation
in the end to try to work out what it was, and I'm not that much wiser. So, is it just orthopaedic operations that productivity for the NHS is based on?
Well, so essentially, as I said before, it's a kind of measure of what inputs you put in. So the number of staff, the kind of resources, the money, those kind of things that go into the healthcare system, and then what you get out of that. And that is mainly activity. And where we count activity in the most kind of concrete way is, as you say, with those hip operations and stuff like that. And so that is the kind of measure you get. There has been increasing recognition that productivity measures are going to have to change to be able to accommodate the fact that a lot of the productivity gains that we might make by making the kind of the government's big left shift that they want to achieve in terms of moving care closer to home won't be covered by productivity. And obviously productivity is a huge thing for the government. Rachel Reeves this morning announced that they are expecting 5% efficiency gains from all departments, and to not to deprioritise some spend that won't contribute towards the missions that Keir Starmer announced last week. And so I think it is it's really important that the measures catch up with where we're seeing care being delivered. And I know that NHS England are talking to the University of York, who are one of the big people who provide those kind of measures, and to the ONS about how they might do that.
So, and primary care and prevention, where does that?
So primary care and prevention, again, it's very hard to see see the productivity in prevention, given that it's an upfront cost often for the realization of benefits in many years in the future. And so it is really difficult to kind of counter that and put that into the measures. So I know that NHS England have been testing, looking at community services and mental health services, but still not quite got to primary care, where we know, and the Darcy review really showed, is one of the most productive parts of our NHS, delivering kind of massive amounts of activity for very little growth in funding over the last few years.
And a little plug, this afternoon we've got Chris Hilton, who's written a paper on productivity, and he's coming along this afternoon. He's works in West London mental health. Chris Band, you're the most productive person in the world, aren't you? Surely that means working harder, right, and faster? What do you do? Are you productive?
Am I
as a
productive?
clinician?
I would say listening to
Charlotte.
thinking about post-COVID, actually, I would say productivity within my services has massively increased. So what we've learned over COVID is the ability to adopt virtual consultations. You know, certainly within diabetes and remote monitoring, I can hand on heart say that we are probably seeing 4 times the number of patients, offering 4 times the number of yeah, absolutely. And we're seeing, and that productivity needs to equate to outcomes, patient outcomes. There's no point in having more appointments without actually something tangible coming out of the end.
Chris, the other Chris too, I should call you Chris too. How do you create an environment? Because it sounds to me that Chris 1 is going to get burnt out quite soon, if he isn't already.
He looks great. He's got loads of energy. How do you create that environment to create productivity? So, I mean, so a big part of our thesis on this at CW Plus is that you empower your workforce to basically help challenge the status quo. So I think one of the things that I'd like to think that most people accept is kind of more of the same will not help us achieve all these targets and these objectives, and where we collectively actually as people, as service providers, as clinicians, want our services to be. So I think you need to look at, you need to listen to your workforce. You need to sit there and say, okay, where are these solutions? We don't do that. Systematically, we're really poor at it. We tend to sit there and ignore the people at the coalface in any discipline and say, okay, you might have an idea about what's going on, but I think I probably know better over here because I've got a helicopter view and I've got the data and all this kind of stuff. And that sure, absolutely, you need that top-down stuff, but I think we really neglect the institutional knowledge that we have at the coalface, listening to people who can say, actually, I can see where the efficiencies are. I can see where we are not doing as well as we could do here. And how do we then operationalize some kind of change there? Because there is a myriad of solutions that can help with that. Be they new technologies, new systems, other organizations doing things really well, we can learn from each other. But I think you've got to have that kind of empowerment of the local workforce and say, what are the problems as you see them? That is a productivity win waiting to happen in pretty much any kind of discipline.
And so those are words which kind of think, well, whatever. But actually, you've lived that, haven't you? You've celebrated 5 years of innovation at Chelsea Westminster. Can you just share some of the things you're doing and maybe give some practical tips for people as within their organisations that they could go and adopt?
Yeah, sure. I mean, so CW Innovation was 5 years old as a program in October. We've run 200 innovation programs. We've got over 100 partners working with us now. And it's all started off really with this idea of how can we bring SMEs into kind of come and test and trial their new ideas, provided they'd been properly vetted, properly validated. And we had some great partners like the Digital Health London Accelerator with us right from the beginning, who was kind of feeding these companies in. But the challenge that we had from the outset was the lack of engagement from NHS staff in that process. So everyone went, yeah, of course I want to change stuff. Of course I want to try new stuff, but it's difficult. Changing anything, onboarding anything, that's really hard. I don't have the time. People are trying to sell me stuff, inverted commas, all the time. So actually what we managed to do is change the initial kind of that slight culture of cynicism, particularly in the kind of management classes. we said, yeah, you've written into your strategy, like pretty much every acute trust in the country, we're going to be digital leaders, we're going to be onboarding digital, it's going to be great, everything's going to be digital. And it's like, well, you're not actually doing that stuff. You're bringing in a new electronic patient record system,
which doesn't link to anything else, right?
But actually, how are you putting those words into action? And what we're able to do is kind of slot, like with most things in life, a little bit of timing, a little bit of luck. We were able to slot that kind of bit of thinking into the organizational strategy, and use that as a hook to start getting the leadership engaged with this idea of going, okay, well, actually, perhaps we can do that. It helps that that we've got this quite unusual partnership between charity and hospital. We're able to fund a lot of stuff, so we're able to seed fund things. So there's a lot of philanthropic support sitting underneath this, but also we've got time, we've got bandwidth, we can build partnerships, we can build relationships, we can horizon scan, all the things that, and time's the most important thing that we bring to the table. It's not money. So you're actually having that time and having the people who can go and find good solutions, learn from others. That's really interesting.
So actually, with the potential opportunity for the other Chris, to actually to develop and learn new skills and be much more engaged and support recruitment, retention. But you've got to create that headspace for Chris to be able to think, rather than saying, now you've got this tool, you should be able to work twice as fast.
Exactly. And what we ended up doing was we created a training program. Yep. So we've got something called the Horizon Fellowship Program, which we run across our whole trust. That's in its third year now. It's had 65 people through. It's a year-long course. The trust gives people some time to come and run projects, learn how to be an innovator. And what that's doing is building a community of people on the ground who've got those skills to spot those challenges, spot those opportunities, and encourage others to kind of get involved. And that's something you'll be pleased to hear, Chris. We're doing a lot more with West London Children's next year.
Where did you get the money from to start it?
So to start with,
did it cost a fortune? I'm going to say the actual numbers.
No, it didn't cost a fortune. So I mean, all in, and I think this is the thing, innovation can be really lean.
Yeah.
I'd say to run our innovation program, which is a dedicated team embedded in our trust, it's grants, it's a whole range of different things to kind of small seed funding grants. It's about £500,000 a year.
Okay.
In an organisation that's got 7,000 staff.
Yeah.
So you can do a lot with a little, I think, in innovation. But part of it, as I said, is the time commitment, it's the mindset commitment, and it's that institutional support. You've got to be able to link it into the things that matter. You've got to show that it's hitting productivity. We measure productivity in the acute sector vociferously. So actually, how the things that we're doing impacting that? How are they helping us support our strategy? That the things that we've published, how are they helping us with recruitment, retention? How are they helping us bring new people into the organisation, bring new partners into the organisation who can help us on this kind of change journey that we want to go on?
Thank you. Austin, you're an academic and an innovator. Like, how do we know? What on earth do we measure? Because there's so many different things, aren't there? Because you're measuring a service, right? You're not measuring an outcome or a product. So how would we go about doing that?
Yeah, I would want to go back to nomenclature, absolutely. When you look at productivity or absenteeism or presenteeism or anything, there are many definitions of that. If you look at the ONS, oftentimes you need to look at what the ONS is saying as a measure of productivity, and that's how you measure things. So measurement is the heart of science, and the moment you have something to measure, then we are focused on that. So innovation, of course, and culture are less quantifiable and less tangible. So how do you measure output and innovation, really? So I'm going to just maybe give a few examples. So the culture of innovators that you're developing is really important, and culture is one of the hardest things to measure and one of the longest things that needs to change. And you can't force a culture. It's hand-holding people and giving them the environment that they need to. Some considerations are intellectual property. If you're innovating as a team, who has intellectual property? If it's open and transparent and everything is shared, that's great. How about academics and researchers want to be on papers? What things are in place to ensure that they could actually co-author papers? Where is the personal and public involvement, or the BPI and so on? How do they engage with technologists and patients to make sure that the innovation, whatever that is going to be embedded and actually congruent and measurable? So that's one thing that I'm sure is known, but it's important to keep in mind. I'll talk a little bit about Innovate UK, which is the National Innovation Funding Agency of the UK.
And who can apply for that?
Many people can. In fact, Innovate UK, unlike charities, MRC and IHR and so on, are dedicated to ensuring that the UK is the best place in the world for SMEs. So they want to magnetize a knowledge economy, SMEs into the UK to make sure that the UK remains solvent. And so ordinarily it's innovators and SMEs that would collaborate with academics or researchers to evaluate a value proposition, essentially. Can you set up business from outside or anywhere here in the UK and do good enough to actually attract clients? So they offer a lot of funding. There's a huge multi-billion pound envelope, whether space science or telescopes or molecular biology. So pretty much any of us can apply for that. It's about finding the right application pipeline and meeting the specific scope. There are different panels, but what I want to say is they have thought horizon scanning. They've looked at the next 20 years and they said, well, how can we make UK the best place, basically remain competitive in the international market? And they've come up with really interesting ideas. One thing I'd like to discuss briefly, because that's very relevant, I think, to all of us in health, is the idea of self-driven healthcare. The idea is that we all have technology, wearables, PHR, electronic health records, but we're not really leveraging that. There are silos of data. And Innovate UK, and we're working closely with them to think about this idea that how can we innovate across the board and ask ourselves, what type of plumbing does the UK need to make all of these data silos work for us, the self-care? Now that takes a big hand because you're then dealing, how can we, we need to create a new infrastructure, a new type of, I think the specifications are there. So that's where innovations are really important. So you're thinking outside of the microcosm of your particular innovation and thinking along how can we innovate across the country to make sure that our silos of data, whether they're personal health records or NHS or otherwise, can actually integrate and give us the self-care value, added value, for example, by AI-assisted clinical coaching or right-in-time motivational messages or our digital twin, and give us insight that means something to us. I went around the houses here, Tal, but
no, I think that data is really important. That's the crux of it, and AI relies on data. If people have got any questions, put your hands up and we'll pop over and stuff. Charlotte, back to you whilst people are thinking.
Can I just come in on that last point?
Yeah.
So on data, I think it's really interesting that we've kind of set up that system to be as unproductive as possible.
Yeah.
And it's really interesting that Paul Corrigan, who's obviously advising West Streeting on the 10-year plan, said recently that because of the way that Epic works and the fact that it can't integrate with the NHS app, that would be a reason to take some of the contracts away, because that's the goal, and having that interoperability is really important to, as you say, Austin, to being kind of able to self-manage, but also to having a productive healthcare system where data flows and follows the patient. And it is really interesting that we've only got to this point now where we've got all that plumbing that doesn't quite work together, and now suddenly people have gone, oh, actually maybe that is really important to having productivity. And I think that's the kind of thing that people don't often think about in terms of how have we structurally set things up to not help people be productive.
And before you answer, Austin, actually, 'cause I think as a clinician in a GP practice or working in a primary care network, we've struggled to get involved in research. And I don't think that the system, fine, secondary care, you've got your own in-house research organisations. It isn't easy for us to access those Innovate UK funds. Fortunately, there are mechanisms, aren't there, that people can get engaged.
Yeah. I'll answer in two parts. Absolutely. I think take the idea of an NHS, a dinosaur, the most loved institution in Britain, that's for sure, no matter what.
Not as much loved as nowadays.
But still the most loved, apparently. And I personally agree, despite the lamentations we hear. But here, look at NEOM, all of these smart cities we hear about in Saudi Arabia and other countries. They're building,
do you want to tell people what that is?
Yeah, sure. They're building, so basically there's the idea, again, this is the future, so a bit dystopian to be honest, but the idea is that you have a desert or an empty plot of land, and you build a city from scratch with exactly the type of plumbing that is needed to make everything, you don't own anything, you don't necessarily have to pay, it's just all recorded, so everything is shared, there's no privacy, but it's protected somehow. And these big cities that are actually being built now, there are many examples in the Emirates and UAE and in the US and so on. There's a smart city complex whereby you live as a citizen, participatory citizen, and you don't own anything, you're just working and living there, and everything is close to you. Like I said, it could sound a bit dystopian, but that's one way to cut across the board and work at innovation, as a strategy. So the idea of the city is to enable that sort of data. Whereas if you want to change the logic of the NHS and the plumbing that we already have, it's very complicated. And then you have, of course, the ethicality, all of the governance things. But to answer your question about the NHS and Innovate UK, you're right. I think primary care, as we've heard,
with a poor relation doing all the work. Basically.
You've done so well in primary care. I mean,
anyone here from primary care? See what I mean? They're all at work. Anybody,
I've got 3 examples.
anybody from secondary care?
There you go.
Oh, they're working too. Who are you guys? You're all innovators. Are you guys all innovative people, becoming entrepreneurs and stuff? It'd be interesting. If you're an entrepreneur, okay, how easy have you found it to get in work with the NHS? Do this like that or that or that. Okay, I'll come over to you in a minute because you have some magic secret sauce that nobody else has. Charlotte, back to you. So back to that productivity stuff. I know it's a bit boring and nobody knows what it is, but if you look at economics textbooks, they say, oh, do you know what? Technology is the answer. Is technology the answer, or is it boring stuff like workflows and looking at which bits connect together and connecting your people together, making people happy?
So I think technology is definitely part of it, and I think looking at some of the ways that NHS England have been talking about it, looking at kind of ambient AI and the kind of gains that can be made in terms of some of the administration elements of kind of giving care, that I think is definitely part of it. And we've also been, as Lord Darcy pointed out, kind of undercapitalised, under-resourced in that area as well. So that will definitely be part of it. It's not going to do everything, though. I think the really important part of looking at all these different analysis of productivity is how multifactorial it is. It really can't be attributed to one thing. There's a whole range of different reasons, including the kind of the mix of staff now we have in terms of experience and kind of. We've got a lot of, there's been a lot of workforce growth in recent years, which has obviously driven productivity down because kind of input has gone up, but output has not necessarily gone up at the same time. But actually, you have to really recognise that a lot of those staff are more junior and are coming in and are kind of working and training and learning about how the health system works, and as a part of that. But I think another really important thing that I think the penny is kind of dropping is about social care and the interdependency. Yeah. Of the health system with social care, and the fact that if you continue to have a system of social care that has no plan attached, has no kind of plan for reform, that will continue to add to a lot of the capacity challenges, which make the system less productive in terms of if you look at bedded capacity. Yeah. And so it's a real mixed bag of things, which means it's not easy to solve, and it means that it has been a very kind of it's occupied a lot of headspace. A lot of people are kind of shaking their head saying, what is going on with productivity?
Thank you. As quiet audience. So, Chris B, is innovation all that sparkly AI stuff? Maybe you could share 1 or 2 cool things that you're doing, or is it doing the boring stuff just that little bit better? Maybe you could give some examples.
I don't think it's necessarily technology. I think it's about approaching things differently, doing it in a different way, more productive, more lean. I think we know that the NHS needs some radical changes, and we need on the ground, and I count myself as being somebody who's on the ground, need to do it differently, need to do it better. And for me, everything is patient outcomes. It's our patient journey, patient experience, as well as when we think about diabetes, which is my speciality, is about glycemic control and quality of life. For me, I love doing things differently, I really do. So at Imperial, we have something very similar to CW+, which is...
is it better than CW+?
I wouldn't say better, because I now work for both.
Okay. Fair enough. You came here with a job and you're leaving without... without one. Well done, Chris.
But we, you know, through Imperial Charity, we were able to develop a healthcare transition. So this is about children and young people transferring to adult healthcare smoothly, not getting lost. So we've developed a hub which is a one-stop shop for all, and we were only able to do that with Imperial Charity funding. I would say that sounds great, but once that funding has stopped, it stagnates. You know, we've now got a 2-year backlog of work that we need to catch up on, and that's, you know, it's not within the priorities of my trust anymore. So
Sad, isn't it?
it is really sad.
Just a really quick point, actually. When you're looking at innovation, look at what people who work with kids do, because, like, if you that is often, if you look around the world, you know, in the UK as well, you know, children's, even within hospitals, the children's wards are the ones that are first kind of out there, because your patients can't really talk to you. You need to find innovative ways of communicating stuff. I'm not a big fan of that word innovation, but can you give some like practical examples of what you've done, which is sort of cool, sexy, techie stuff, and then boring stuff, and then which has been more productive? Put you on the spot.
I mean,
there.
yeah,
I thought we
just
should have met
slightly.
before.
Just the boring, mundane stuff was during COVID. Just, you know, I remember getting an email before it really, the proverbial hit the fan, saying we're potentially cancelling clinics for the next 6 weeks. I logged onto Teams, never used Teams before. Now Teams is you know, my bread and butter. And set up a clinic, you know, just really before there was any true momentum. And I don't know if that's sexy or that's quite mundane. For me, that was just
Teams is not sexy.
no, absolutely not.
Chris, we need to have a chat later. You're in the wrong conference. I need to send you to a different one.
But I mean, I guess for sexy things that I just like doing is just something that's, you know, I think of on a Wednesday morning, by Wednesday evening it's done. Doing a virtual tour of an adult diabetes centre, introducing to staff and sending that to my young people. I think that's really
nice, actually. Yeah.
It's cheap, it's easy. But actually, it's probably quite powerful to those young people that get to see where they're going to in the future.
And they're more relaxed when they get there.
Absolutely.
Don't you meet patients for a coffee in
Starbucks?
Like, we can't say.
Oh, no, sorry. There are
or
other
any
coffee
other
brands
shop
available.
near you.
I will meet a young person wherever they want to meet me, genuinely.
I think that's amazing. And you think, oh, prevention, you know. Actually, like, Chris is quite a nice chap. Well, this one is anyway. I'm not sure about the other one. I've got 2 nice Chris's for you. And actually, that sort of relationship stuff is about prevention, isn't it?
Yep.
And showing the hospital ward before you get there in 3D, wherever.
Absolutely.
They're little things, aren't they? They're not like AI things. They're just human beings.
No, but there's a huge amount of payoff for doing that. Me buying, you know, a 15-year-old a hot chocolate in one of the coffee shops around Paddington can be really powerful. It breaks down a lot of those professional barriers. It's neutral space.
Yeah.
It makes a massive difference.
Thank you. Chris, how can you, if I were in your hospital, if we were all working in your hospital, and Chris A or B or whatever won, he would get onto your program, wouldn't he? And I wouldn't. And I'd be sad. And I might be less productive. Is there a chance that large organisations have this? So how do you have a little area which is focusing on innovation? It really annoys the larger organisation itself, because they think, hang on, they don't have to follow our rules. They do what they want, and they get time off, and they this, and they that. And how do you reconcile that?
I love this question. So I love this. This was the exam question, and I thought it was it's a wonderful nonsense.
It's true though.
I will challenge that they don't get that the organisation looks in at this little cabal of people and goes, "Oh, they don't have to live by our rules. That everyone has to live by the same rules." Now, I think that's why innovation's got to be an aspirational thing. So if people want to do it, that's where the management class of your organisation needs to endorse that. They need to understand the value. They need to understand the value in saying, okay, I'll give that person half a day, a fortnight, to go and do this bit of learning because I'll see the return on that. And that's why it's not an academic exercise. Yeah. There's a practical element to it. So they're doing something that's going to help that service. Otherwise, it is just, we'll go and take a study day.
Yes.
Very different. Does it create friction in the organisation? I think the frictions that I've seen are nothing to do with that release of time. I mean, people try and, there's a bit of pull and push on that. That's completely understandable with busy services. The frictions tend to be when you're doing things that are right at the kind of the leading edge of, of the technology side of things. So, you're all going to be hearing lots about AI, but, we've done some stuff in AI recently, and you realize that, that you are right at particularly when you're bringing it, we've just, in our dermatology service this month, we've launched pretty much an autonomous AI system. Now, that's taken an inordinate amount of time to get to that point because of all the restrictions and all the regulations that weren't quite there. So they were kind of there, but you had to just double check absolutely everything with every regulator, every system, double check, because we know that if you want to shut something down immediately in any healthcare setting, you go, well, I don't think that's safe.
Yes.
Regardless of whether it is.
For example, Chris's coffee shops, you think, oh, you're breaching confidentiality, aren't you? And
exactly.
We do a bit of social media stuff and say, oh, well, you can't put that on. Yeah. So but actually we hide behind governance, don't we, sometimes, to stop doing things.
Yeah, and I think that's, and sadly I've seen plenty of examples of that, which is really, it's people saying, we haven't got time for this, or I don't really believe in it. And you can, there's many a field, an acre of long grass that you can punt ideas to if you're minded to do that. But I do think there's this, I said the concept of buy-in from at the kind of senior leadership point of view, that link into strategy is so important, because it gives people that bit of freedom to try that new thing. So it's that permission in a contained way, permissioned in a structured way. But I think that it is, without that, all innovation is in a lot of big organizations, and this is a hobby horse of mine, is innovation is a hobby. Yeah. It's not like research. It's not like quality improvement in a lot of organizations. It's like something that this little group of people. You said it's not about research. I'll let you answer that one in a minute. Yeah. So I think if you don't have that structure. Yeah. There's I can see you're making a valid point. There might be so
you're saying Chris gets onto your program, I don't, but he then shares what he's doing and engages other people in what he's doing. And that's part of the innovation. It's not like doing stuff. It's about bringing the other team with you. Austin, he's just said research was not very good. What is not important? What are your thoughts? I'm going to go around and pick on people.
I would sort of agree, in halfway. I'll tell you a couple of things that I think are really relevant, really interesting panel. I'm really pleased to be hearing all of this. I think, what is innovation? Is it measurable? I think retrospectively it is, yes. We got some funding from the NIHR to develop a team science approach to tackle a complex problem. So in NASA, oftentimes they put a florist and a school teacher and a bus driver and a chemist and so on. They could put people from different walks of life together in a room. They say, well, how can we invent a pen that writes in zero gravity? These are complex, and people will have innovative ideas. So this team science approach is one way to find the innovation between people who aren't innovators, but because there's this sort of place where people can feel free to just have wacky ideas and so you triangulate and something can come out of that. Also, I want to reflect on productivity. So it's programmed activity. So if you well, or maybe not, but if you say this is what it means to be productive, then people are focused on that. Whereas you also mentioned quality is more important, patient journey. What are the real outcomes? What do you really want to do? So I think it's a combination of all of these. And how come you hear of serial entrepreneurs, people setting up companies and moving on? What is it? What is that magic ingredient? Or serial innovators? Are they born innovators? or are they able to innovate practically because they are able to tie up, loose ends and engage with people and facilitate the innovation? So I don't know the answer to that, but certainly I think we all have innovators within us. We've innovated. I want to conclude by saying that unfortunately the NHS is very difficult to innovate in because of the governance and it's very slow and also very inefficient. So you could say, well, we're improving productivity by 1.82%. It sounds like a lot, but actually if you look at how much money is spent on renting NHS infrastructure, like hospitals that are built by private, you're like, what's the point? Billions are being spent, evaporated every year on rent. Whereas if only a decision maker would say, let us build our own NHS hospitals, over the course of whatever, you could save so much money that productivity becomes less relevant. It's more of the quality. Again, around the house.
Well,
here,
to start off, you can open that Saturday and Sunday, can't you? Because that would improve productivity and potentially give the workforce the opportunity to work flexibly and to have ways of working. Right, we have an innovator here who is a serial entrepreneur. Is it Weetabix or cornflakes? Tell us how you did in the NHS, how you managed to navigate the NHS.
Okay, well, I'll tell you in a year or so. No, my name is Laszlo Bax. I'm the CEO of BrainGaze. We basically offer solutions that help with ADHD waiting lists. So we got something which is really attractive for many, many people in NHS trusts. So we get a lot of interest. They're really receptive. I think I'm Dutch. I've been doing a lot of business in other parts of Europe. Coming to the UK, I'm very, very pleasantly surprised about the receptiveness of, hey, you got something new, let's talk. But then after that, let's talk, it's really difficult. People don't have funds, don't have time, so they're kind of swamped into just surviving their daily jobs. And then I come in and I have something strange. So that's one thing. I think they just don't have the funds or the time to actually engage with what we have. The other thing I noticed, which I think is really interesting, so a CIO of one of the trusts said, hey, Laszlo, what you got is really great, but it's not the full solution. I want this and that as well. Could you help me to get that? And then I think, okay, but that's not my job. It should be the NHS bringing those innovators together.
That's firmly yours, Chris. Go for it. Oh, the NHS is not set up for innovation. I'll come back to you.
We're trying to answer that. Okay. Well, so it sounds like an amazing company and right on the money in terms of something that is a huge challenge. I think actually, Chris and team, you guys have done some amazing work over the last couple of years in terms of driving down those waiting lists in Northwest London, which is, well, I think, a huge accolade to this man here. I think what you've just described is a classic challenge. It's like, where's the funding? So I love Innovate UK. Sorry, I've been waiting. This has been in my holster now for about 2 minutes. But we do invest an inordinate amount of money in invention in this pathway, don't we? And yet it gets to the point where you go, right, I really want to test this in a real world clinical setting. It goes, well, no, I haven't got any money. So where is the money? Whose responsibility is it to fund that? I think it's a question that we are still wrestling with. I've seen some really interesting moves over the last kind of 3 or 4 years in terms of how NHS England looks at innovation, looks at funding, and a nice hedging of bets, I think, away from a very centralized model into a much more local model. We're part of the local model, a big network of 19 trusts working across the country, I think, delivering good results. But I think ultimately it's about finding good front doors for companies and actually a mature infrastructure to say, okay, well, I understand where my problems are. So the conversation you had with that CIO is very typical. It's like, this one bit of my jigsaw is great, but what about the rest of my jigsaw? But actually, do we really understand where the challenges are? What pieces are we really looking for? And what are we actually trying to procure as part of that solution?
Thank you, Chris. So the NHS has some more work to do. And actually, the main thing is that we're losing out on talent. So some of you might think, oh, Chris, is that giant hospital trust and all these big organisations and stuff? You think, well, but I'm only a little teeny-weeny organisation. I work in general practice or in a primary care network. So I'll hand you over to Sarah. Declaration of interest, we work together. I've planted her and I've given her a question. So Sarah, oh, hi, how are you? I didn't know you were here. Tell us about the innovation hubs you've set.
Talk about being put on the spot. So we set up something called Innovation Labs, where we work with staff in the practice, so clinical, non-clinical staff, people who wouldn't usually work together, put them into small groups and give them allocated time to work on specific projects. We've also tried to implement this within our PCN with about 50 staff members, which has been very interesting, but people generally really enjoy it and found it, really interesting.
And how much did it cost?
Nothing.
It costs nothing, right? So you reorganise people's work, going back to Chris A, bound. You suddenly have, Charlotte, a more productive workforce. Last question, and then we'll wrap up.
This is for the Chris from CW+. What advice would you give an organization that's looking to enter into the UK market, has a ton of credibility from, say, the US, a lot of good ROI and some incredible data around throughput and managing patient workflows? How would you approach it? How would you suggest that company enter the market?
So I can see people flashing ever-reducing number of digits at the back of the room, so I'll try and keep this quick. My one piece of advice is probably try and get on some kind of accelerator program that has got a clear track record, and there's a number of really mature accelerators that will help get things into the NHS. What that'll do, it doesn't necessarily mean it's about improving the actual business, but it'll help you understand that kind of readiness for the NHS market, and I think that's where a lot of mature businesses, particularly coming over from the US and overseas, come into the NHS and go, well, we kind of know exactly what we're looking at here. No, there are some really quite fundamental differences, and I think getting onto one of those programs, it's a good investment of time, and it will help kind of get you ready to have that conversation. It'll prepare you for the questions that are inevitably going to come. So I'd say we work really closely. If you're in London, go to the digitalhealth.london accelerator program. They're brilliant.
Right, we have got 30 seconds. So one tip, Austin. Presumably it must be measured.
It's a bit of a platitude. Innovation is 99% perspiration, 1% inspiration, and it's the 1% that counts. And we hope we all find the 1% and then go to Chris for funding.
Chris, top tips.
So I think you've just kind of started. I was going to refer back to the session before this, and Shafi and Ali Pass are talking about that kind of like be prepared to work twice as hard as everybody else. I think that's one of the secrets of innovation. Serial entrepreneurs who wear NHS lanyards and don't wear NHS lanyards are the guys who email me at 10, 11 o'clock at night on a Sunday night, because that's where they're finding the time to do it. So be tenacious and stick with it.
Chris?
Always see the patient. First, last, always.
Thank you. Charlotte?
Well, I guess we need to adapt kind of what we measure, and to Austin's point, making sure that we're kind of keeping up with what's about to happen and kind of the reforms that we're looking at.
Don't measure it. It ain't happened. Thank you so much, guys. Have a great rest of the day. And make sure you're back here in the afternoon, because I've got another little session then.